it's very difficult, I think, if you were a soldier to be able to describe what it would be like to be in combat. And I think if you haven't had cancer and haven't had really serious, awful chemo, it's very difficult for someone else to really understand. And so the people in my group, we didn't have to explain, and we didn't really want sympathy, but so we didn't have to, we could just joke about how awful things were, or, understand what someone was feeling when, like you'd say, I'm really tired. And people say, oh, yeah, me too. It's like, no, you really don't understand. I'm really bone tired. But in group, we didn't have to explain it. And I did end up going to a therapist for 3 years. She specialized in people with terminal illness. The very, very best thing I could have done in my whole life. There was, you have I was sailing along. I had, everything outwardly looked pretty good. But when I couldn't use all of those outward things, it was, what do I do? And who am I? And, why do I feel this way? And she was able to kind of walk me through it, I was like, oh, okay, well, that's really good. I think my whole life, I think if there was something that the diagnosis gave me, it would be that I had to look deeper inside.